Hi everyone, I am Dr. Naveen Tota, consultant neurologist on Institute of Neuro and Cardiac Sciences, NK-Padu, Vijayawada. Today I am here to talk about epilepsy and what is epilepsy and what are the steps to prevent it, that how to treat it, and what are the myths and reality about epilepsy. Epilepsy as such, in Telugu it is called as Morcha Vyadhi, is a tendency to have recurrent seizures. Recurrent seizures means fits. Fit is an involuntary movement or involuntary episode that occurs due to abnormal activity in the brain. And basically, it can occur in any age group, both genders, male and female, and it depends, and the cause depends upon the age. And most of the patients, nearly 70% of the patients who suffer from epilepsy doesn't have, we can't find any cause on the workup. And nearly 30% of the patients, that is a minority of them, will have due to secondary to infections, tumors, and metabolic causes and inherited causes. And the first category is idiopathic epilepsy, and the second category is epilepsy due to secondary causes. In the first category, idiopathic epilepsy, it could be due to genetic causes, or most of the causes is unknown. These patients require to take the drugs for at least 3 years, and after 3 years, and there is a myth that for how much time the patient should take medication. It depends upon the individual cause and the age of the onset and the cluster and how many years the patient is suffering from. And the second cause is the cause due to secondary causes. And most of these patients will require medications for around 2 years, and on treating the underlying cause, and they subside. And what are the steps if you are going on a road and if you see a patient with epilepsy, what you should do? Or a patient suffering from a seizure. Do's and don'ts. Do's: let the patient have the seizure. Keeping a key or any iron thing in the hands of the patient doesn't relieve epilepsy. Whereas what you should do is allow the patient to have the seizure. Turn the patient to the right or the left side and pray so that the patient can freely move around. Don't restrain the patient. If you try restraining the patient cannot control the movements, and you will end up breaking the bones and harming the patient. And clear the place around the patient so that he won't hurt himself by moving around. So that is the initial step. Let the patient, then you call the ambulance and take the patient to the nearest hospital and take the doctor advice for the patient, and the doctor will determine the appropriate treatment for the patient. That is the patient. And once you are diagnosed with epilepsy, what are the steps you should take? First thing is have adequate sleep. Because sleep and stress are the two things that can precipitate seizures. That at least 7 hours of sleep each night is required for the patient. Undisturbed 7 hours of sleep is required for the patient. And for the initial 3 to 4 months till the treatment is established and the patient is seizure free, the patient should not do risky jobs like driving and climbing over heights and swimming, so that to prevent drowning. These are the initial steps to them. Once the treatment is established, the doctor will determine the duration of your treatment and give you appropriate things. Most of the in children there is epilepsy called, the most common epilepsy is absence seizures. In the absence seizures, the patient keeps blinking, and there won't be a typical seizure like a seizure activity and like movement of the limb. The patient just blinks and stays. The first thing, the most often these seizure is brought to the attention by the teacher, telling that the patient is not studying well or the grades coming down. So if you take this is the most common called as absence seizures in children. If you take him in time to the neurologist, he will advise you appropriate therapy. After 2 to 3 years, the patient will become seizure free and he can go back to the school and do his activities normally. So epilepsy is like any other disease. Epilepsy is not should not be treated differently. Epileptic should not be treated differently, and they should be treated appropriately. And all the measures should be taken so that they can mingle with the community normally. Thank you for this.